Good morning, everyone. Thank you for joining our press briefing. And let me start with the epidemiological update on COVID 19. Globally, with over 9 million confirmed COVID 19 cases and over 400,000 deaths reported to WHO, the pandemic continues to accelerate, with a record number of new coronavirus cases reported on Sunday, with 183,000 confirmed in 24 hours. Over 2.5 million cases have been reported from Europe. While the European region is reporting a decreasing proportion of global cases than earlier in the year, the region continues to report close to 20,000 new cases and over 700 new deaths daily. Last week, Europe saw an increase in weekly cases for the first time in months. For weeks, I have spoken about the risk of resurgence as countries adjust measures. In several countries across Europe, this risk has now become a reality. 30 countries have seen increases in new cumulative cases over the past 2 weeks. In 11 of these countries, accelerated transmission has led to very significant resurgence that, if left unchecked, will push health systems to the brink once again in Europe. Countries such as Poland, Germany, Spain, and Israel have responded quickly to dangerous outbreaks of COVID 19 associated with schools, coal mines, and food production settings that have occurred over the past several weeks. Where new clusters of cases appeared, these have been controlled through rapid and targeted interventions. This is very good news. Bravo to the authorities. And on another positive note, several ministers of health have reported a change in people's behavior, namely that they are adhering to physical distancing and wearing facial masks. Bravo to the people. At the same time, we need to get smarter in using the evidence and the information we have from our COVID-19 surveillance systems to improve the only way we have to minimize transmission. Find, isolate, test and care for every case. Trace and quarantine every contact. Here, digital technology can play a leading role, not least to support contact tracing. Austria, Georgia, and North Macedonia are among the 27 countries that have released national solutions for digital contact tracing in Europe, with at least another 4 countries, Andorra, Finland, Ireland, and Portugal, having solutions underway. Digital technology and artificial intelligence have also proved to be effective in other aspects of the pandemic response. In France, an artificial intelligence-based virtual phone assistant is able to respond to more than 1,000 people at the same time. Italy is trialing use of an artificial intelligence-based technology that utilizes a smartphone app and camera to capture vital statistics such as heart rate, oxygen saturation, and respiration rate in real time. In Sweden, telemedicine has been used to support traditional care, particularly in rural settings, and is now being used for enhanced COVID-19 response. Digital technologies have proved to be powerful tools to fight COVID-19. However, the same technologies have exposed us to a tsunami of information and have raised many issues around data protection and privacy. Here, I wish to convey 3 messages. First, go digital, but go wisely. Digital helps health systems cope with the delivery of essential healthcare, particularly during emergencies. But integrating digital health must be done carefully and wisely, in partnership with the public and patients. Secondly, it's all about trust. Digital tools rely on public trust. Interventions must consider the privacy and security of individuals and their data. Fundamental human and gender rights must be preserved in digital environments and must not be forgotten in times of a pandemic. It is the responsibility of governments to address data ownership, use, consent, and protection. Thirdly, we cannot afford to have people that cannot afford digital health. Not all social groups are equally able to harness the potential of digital technologies to combat the virus. In the European region, national data on household internet access varies from 74% to 87%, with greater variation at subnational levels and between population groups. We cannot afford a digital divide on top of the social and economic divide. So, three messages. First, go digital, but go wisely. Second, build trust by respecting privacy. And third, address the digital gap. The full potential of digital health is yet to be realized. It is about empowering people to make healthy lifestyle decisions to create a European culture of health. Ultimately, it is about leaving no one behind. Thank you.